Yeah, so I think, unfortunately, we cry again with another negative Phase III trial. The VERONA trial, of course, originally read out at SOHO in September, but we do have another oral presentation followed by Dr. Garcia-Manero. I'm looking forward to actually looking at a lot of the subset data. I'm hoping we'll see more data on mutant versus wild type, increased blast versus not, as well as potentially outcomes to transplant. I think that being said, we've now all extensively used HMA Venetoclax in real-world data. I think there's at least 4 large cohorts being presented at this meeting, including an oral presentation that we're a major contributor for. I think in p53 wild-type HMA-Ven, particularly for excess blast and certain molecular subsets like ASXL1, is still a game changer and is truly majorly increasing responses. I think you have to optimize Venetoclax. I think you need to think carefully about patients that may go to transplant versus not. And so I still think there's a major role for Venetoclax. Maybe more importantly, there's a number of new BCL2 inhibitors that may have differences, half-life, et cetera. And so I think for the way forward, we need to do smarter trials, maybe, again, mutant versus wild type, and again, optimizing really the patient demographics that may be best suited for the response. It clearly has a role, and I think these data are pushing maybe how we should think about it, particularly for groups like ASXL1.